Hey, everybody, this is Dr. Kevin McGovern, and I'm coming to you live from Perfect Motion Sports Therapy in very sunny Acton, Massachusetts. Today I want to talk about a little feature I have here, a little, what do you call it, PDF or something. I don't know. Let's get it up on the screen. We can talk about it. So the title of this little presentation is You Only Have One Body, so let's take care of it. A physical therapy guide to injury prevention. Most people really only come to see a physical therapist when they are actually injured. I think that as a therapist, we do a lot more good in helping people stay healthy and not be injured. A lot of times that's not reimbursed by insurance, but some of you may know I am a concierge-based or cash-based or fee-for-service facility where you can come and pretty much get anything you'd like. We do not have any boundaries from insurance companies or payers or anything like that. So you only have one body, so let's take care of it. The dentist. You go to the dentist, what do they say? Brush and floss twice a day. Why? Well, you only have one set of teeth. Miraculously, you only have one body. So we need to take care of that too, just like we take care of our teeth. Who do I help? Well, athletes of all kinds. What do we mean by athletes? Well, I mean all kinds. We have elite, we have recreational, we have industrial workers, we have the weekend warriors, and we have the professional couch potatoes. That's right, we help you too, because essentially I'm a professional couch potato. So what do I do as a physical therapist in this facility? Well, I help athletes recover from and or prevent injury to keep them healthy and physically performing at their very best. Whether you are a high-level high school baseball pitcher or you're a elderly grandmother who just wants to keep up with her grandchildren, you need help with that, I can help you. Well, how do I do that? Well, first of all physical therapists, when you come and you get an evaluation, we assess you, we look at all moving parts of the body, range of motion, strength, but more what I do is I really correct the neurological sequence of human movement. Well, you're saying, what the heck is that? Well, movement is math. Okay, A to B to C, 1 + 2 + 3 = 4. The body moves in very much the same way, and there is a sequence. And when you get out of that sequence is when most people become injured, even if that injury is a trauma. A lot of times you have been out of that movement sequence, which has caused the trauma to begin with. So why is this so important? Well, this is a good coming from my father, who was a lifetime safety manager at a chemical plant, where he said that all accidents don't happen, they're caused. So a little spin on that. All injuries, whether trauma, repetitive, or accidental, have a component of poor basic human movement. We have a problem evaluating that movement dysfunction in today's medical model. Okay, like I said to start this, you really only come to see a physical therapist after you've been injured. And that usually requires an X-ray, an MRI, a long process to get to us, which is a really big issue in today's medical model. Go to see the primary care doctor sends you to the orthopedic doctor, maybe there's an X-ray, maybe there's an MRI, and finally, 6 or 8 weeks into your back pain, you finally get to see a physical therapist, when if you'd gone to see the physical therapist to begin with, you probably would be out of back pain in 8 weeks. Insurance-based physical therapy must bow to the big insurance companies, leaving the consumer the victim. And what do I mean by that? Well, I owned an insurance-based physical therapy practice for about 13 years. And basically, we're slaves to them. They tell you what you can do, when you can do it, how you can do it, for how long you can do it. And the patient is never first and foremost in that model. It's cost cutting or chopping or however you'd like to call it, but it's certainly not the best environment to get the best care for you or your family. Insurance only pays for one body part at a time. They have tunnel vision. So what do I mean by that? Here's a quick story. When I first opened this practice back in 2019, I was doing some home care, and I had a woman who, wanted to come to the practice, but she didn't know if she could afford it. She wanted me to, to see if I can refer her to, some local physical therapist. And I said, look, they're not going to treat both of your knees at the same time. She's like, what do you mean? I bilateral knee surgery. I said, I'm telling you, they're not going to do it because insurance doesn't pay. We called 7 providers in the area, including the local hospital. All of them said, we'll start with knee 1 and then move to knee 2. How does that even seem plausible? But it is, and that's what they do. When you come to a fee-for-service or cash-based physical therapist, we don't have those restrictions. And the body doesn't work that way. It's not just your knee. Your knee's connected to your pelvis, to your back, to your ankle, head bone connected to the neck bone, connected to the backbone. That's how the body works. It doesn't work in tunnel vision. Like I said before, movement is math. The body is a precise series of movements from head to toe. If your therapist's evaluating and treatment skills are limited by insurance restrictions, what result do you think you're going to get for your injury? Think about that for a second. If you come in and, with a diagnosis of shoulder pain, but your therapist says, you know what, your neck or your mid back doesn't look correct, or doesn't look right, or that's, contributing to your injury, the hoops that therapist has to jump through to even begin to get that treated, or whether insurance will, cover it at all, since you came into the facility with a certain diagnostic code, it's a big issue. And, that's why I started this practice, a concierge level or fee for service type of practice where you can come in and get healthy, because that's essentially a physical therapist's job is to get you healthy. And I always say this, everyone trusts the physical therapist to fix them when they are injured. Imagine what they can do when you're healthy. So what is a concierge physical therapy practice? I work for you, not the insurance companies. That allows me to use all of my skills all the time, with every piece of knowledge I have, with every tidbit of information or trial and error that I've ever had. I'm able to use that without any sort of restrictions. Why do you need a physical therapy practice? Well, or I should say concierge physical therapy practice. Here are some numbers of my patients essentially over the course of 27 years of practice. Now, these are ballparks. We have stuff that's called, or statistics called outcomes, which is a measurement of essentially visits per case. So these are combining many systems. They are ballpark. They're certainly not exact. So shoulder surgery, rotator cuff, labral, bicep tendon tears, the whole gamut mixed in. Average 24 missed days of work, 23 days of PT treatment, meaning coming in for a minimum or an average of 23 visits. Here's the big one: 240 days of lost activity from sport. All right, so if you're a tennis player, you're out on average almost a year. 8 doctor visits, and of course, the MRI machine, X-ray machine, you've got to be run through 3 or 4 times just to make sure, that your shoulder's still intact. So that's shoulder. Let's look at another one. Spinal surgery. 62 missed days of work, so almost of 2 months. 35 days of PT treatment, and of course, spinal surgery would include discs, fusions, trauma, all kinds, the whole gamut. 345 days of lost from sport or activity, 12 doctor visits, and a minimum of 6 MRI tests or injections or something on that end. That's a lot. That's a lot of time. If you're over 40 and you need preventative care, come see me. Perfect Motion Sports Therapy, 45 Great Road in Acton, 978-651-1812. Please like this channel. This is the first post I'll be doing. Each week I will post information about different injuries, different tidbits for health. So stop back every week and come see me. Thanks for listening.